Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Suria Hidayah binti Muhammad Yusuf. My metric number is 1221793. My research title is Emotional Development of Children through the Teaching of Prophet Muhammad sallallahu alaihi wasallam and Islamic Therapeutic Approach. The problem statement is emotional issues among children are becoming more common in today's society due to stress, broken families, peer pressure, and unhealthy exposure to social media. Many children struggle to express or control their emotions, which can affect their learning behavior and relationship with others. Children should grow emotionally strong with guidance rooted in values like compassion, which is rahmah, passion, sabar, and gentleness, rifq, as exemplified by Prophet Muhammad sallallahu alaihi wasallam in his interactions with children. Modern challenges such as family issues, peer pressure, and media exposure have led to emotional instability among children. In emotional development strategies, Islamic approach are often overlooked. As a result, many Muslim children may not receive therapy that aligns with their spiritual and religious values, potentially leading to emotional struggles, behavior problems, and disconnection from their faith-based identity. Recent studies also highlight that integrating Islamic teaching into mental health education enhances emotional stability, reduce behavioral issues, and strengthen well-being among Muslim youth. This study proposed to explore the teaching of Prophet Muhammad sallallahu alaihi wasallam as an Islamic therapeutic approach to holistically support children's emotional development. Research gap. Emotional therapy for children is a structured method aimed at helping them understand, express, and manage their emotion in a healthy way. Common techniques used include art therapy, play therapy, storytelling, and cognitive behavioral therapy, which is CBT, which are effective in reducing emotional distress, improving behavior, and building resilience. However, there is a notable gap in research concerning the integration of spiritual and religious elements into this therapeutic practice. The life of Prophet Muhammad sallallahu alaihi wasallam provide rich emotional and moral guidance that holds potential as a therapeutic tool for children. Therefore, it is essential to explore how prophetic teachings can be effectively applied in emotional development, paving the way for more holistic framework that nurtures both emotional intelligence and spiritual well-being in Muslim children. Next is methodology. Approach is qualitative and the design as basic qualitative study. The first research objective is to identify the core emotional needs of children from an Islamic perspective as reflected in the teachings and tradition of Prophet Muhammad sallallahu alaihi wasallam. The research question is what is the core emotional needs of children according to the teachings and tradition of Prophet Muhammad sallallahu alaihi wasallam from an Islamic perspective. Next is the method of data collection. The first is interviews, which is Islamic scholars, teachers, or parents familiar with prophetic tradition. The instrument is interview protocol, document analysis checklist, and observation checklist. The second research objective is to explore the method of approach used by Prophet Muhammad sallallahu alaihi wasallam in addressing and nurturing children's emotional development. The research question is, what method and approach did Prophet Muhammad sallallahu alaihi wasallam use to address and nurture the emotional development of children? And the method of data collection, the first is interview like Islamic educators or parenting expert. The second is analysis of selected hadiths focusing on Nabi's interaction with children. And the last one is observation of teaching session that apply prophetic values. The instrument, interview protocol, hadith analysis sheet, and checklist. The last research objective is to examine the therapeutic values embedded in the Prophet's interaction with children that contribute to emotional stability and growth. The last research question is, what therapeutic values are embedded in the interaction of Prophet Muhammad sallallahu alaihi wasallam with children that contribute to their emotional stability and growth? The method of data collection is interview, which is child therapist using Islamic approach. The second is analysis of case, and the last one is review, which is Islamic parenting books. And the last instrument is interview protocol, case study protocol, and content analysis metric. That's all from me. Assalamualaikum warahmatullahi wabarakatuh.